We are in London with Susan Cole, National AIDS Trust. Let's talk about these cuts which are affecting also people with HIV and all the services for people with HIV. How serious is the situation?
Cuts to services for people living with HIV is extremely serious and having a devastating impact on the lives of people living with the virus. We're seeing these cuts across the country. HIV support services, many of whom are they get their funding exclusively from local councils, and councils have been affected by government cuts, national government cuts, which in turn is affecting the local support services. We're seeing organisations across the country, many of whom are having all of their funding taken away, and this has led to organisations facing closure. People living with HIV are very much reliant on these support services. That it's not appropriate because of the stigma around HIV for people to go often to generic services. I've been involved in focus groups across the country, and we're hearing people saying that without these support services, people have said that they would likely have committed suicide by now. They're entirely reliant on these services, and there's nowhere to go if they don't get these services. As a result, we have a coalition of HIV organisations across the country have set up the Stop the Cuts campaign. There's a number of ways that you can get involved. You can write to your local council. We've written to Jeremy Hunt. If you do want to get involved, if you go to www.stopthecuts.org.uk, it tells you all the different ways that you can get involved.
What are these services about?
The HIV support services give a wide range of services to people living with HIV. It can be advice about housing, about medication, and one of the areas that's really important is peer support. Often it's the only opportunity people have to talk to other people living with HIV. Lots of services also do testing. They encourage people to get tested. So essentially, without these services, there will be more people contracting HIV, which will have an impact on the health service in the long run. So it's a short-sighted approach.